Welcome to Medic Life, a video podcast for EMS professionals with your host, John Newton.
Hello everyone and welcome to Medic Life Studio here in Augusta, Georgia. I'm your host, John Newton, and in this episode we'll be discussing a recent article that is somewhat controversial. So earlier this week I was looking through some blogs related to EMS, and I came across an article that many of you probably have seen. It's really not new. It's about ALS versus BLS. However, even though it's not new, I began reading the article. I was curious. And even watched the attached video. And I found myself asking questions like many of you have if you've read the article, and many of you probably will once you do read the article. And some of the things that I asked myself, or I wondered, was what was the definition that they actually used for ALS versus BLS? What did it really mean in this study? I saw some discrepancies in the description of ALS care in particular. They described ALS as utilizing SAEDs for cardiac arrest and not cardiac monitors. They also stated that endotracheal tube placement, while this is ideal for standard of care, I acknowledge that many services, they've kind of gone away from ET tube placement and went to a King or a King type airway in cardiac arrest. This data that they utilized, if you look at the study, it was from 2006 and 2011. So I had to ask, how does the 2010 American Heart Guidelines reflect in this study? We know that the guidelines are rolled out at the end of the year, and it usually takes us a year or so. So there's a lot of things that kind of made me question what they were really looking at. And I will tell you that in this study, they used Medicare patients from an urban setting, and then they just used a cross-section of them to kind of randomly pick their data. Now, I can honestly say that I was a little miffed when in the article they said load and go versus stay and play. And they were talking about ALS versus BLS. In most cases, those who do stay or choose to stay do so because of established protocols that follow the recommendation for care that is often provided inside the hospital. And you guys know as well as I do that not only is EMS overworked, but our hospitals are. So they expect us to provide care so that this patient doesn't have to wait sometimes 20, 30, 45 minutes to an hour for the care that they're going to need once they get to the hospital. They didn't really even establish what they meant by stay and play. So I thought that was kind of interesting. My conclusion is that they took some old data, and that only tells us part of the story. It leaves a lot of questions unanswered. It also begs the question, why only utilize Medicare recipient patients? So I wanted to be fair, so I reached out to a provider I know to get his opinion. So the provider that I picked, his name is Russ. He's been in EMS, he was a Vietnam medic, and he's been in EMS for greater than 30 years as a provider and an educator. So Russ says this: the statement catching my attention is advanced life support ambulances are responsible for 65% of emergency care for Medicare patients in the United States and are dispatched preferentially for patients with life-threatening conditions. And that's a direct quote from the article. And this is what he says in response to that comment. If the theory in the study were valid, then the survival rates would be 35% higher with BLS only. As for the cost efficiency, add to the BLS charges the LS procedures, the ET, the IV, etc., done in hospital as compared to pre-hospital. I'm guessing the in-hospital charges are a lot higher. Hey Russ, thank you for sending in that comment. Russ makes a good point. and I definitely agree with him. We really need to take a look at the validity of this report before we start making changes. And other reports like this. What are they telling us about us as the EMS provider? So what I've done for you guys is I've attached a link to the report in the description of this episode, and I encourage you to read it, maybe even watch the video that's attached to it, and make your own assessment. Think about your service, your EMS system, and how does it apply? Hey, so guys, what I've done for y'all is I'm going to start adding in a question of the week. So our first question of the week for the viewers, I would like to hear your thoughts on guns and EMS. Now, this is a hot topic that I would like to discuss in a future episode, so I'd like to hear what you have to say. If you'd like to be a guest or just have some words about this specific topic, send me an email. Also, in the upcoming weeks, look for a discussion on the new 2015 AHA guidelines. Yes, guys, they rolled out, posted up today. So that circulation guide is out for you guys to peruse, and I think you're going to be surprised at the changes or the lack of changes. If you would like to be a guest on the show or have ideas for show topics, send an email to jnewton.mediclife@gmail.com. Now, I'll, as always, post that in the description of this episode. I do respond to all emails and look forward to hearing from you. Until next time, I'm your host, John Newton, and this has been another episode of Medic Life. Thanks for watching and stay safe out there, guys.